Today, we're just thrilled to have Jill Lewis with us as our guest. Jill is an educator who has over 40 years experience working with neurodivergent children, their parents. Jill has a bachelor's degree from the University of British Columbia, as well as she has a master's degree in cross-cultural studies with an emphasis on Indigenous education and urban learners. Jill, welcome to the program.
Thank you very much. Happy to be here.
Thank you for coming. Thank you for coming. Jill, how did you first get interested in special education?
Through family. I have an aunt who has Down syndrome, my mom's youngest sister, and we spent a lot of time with her. And I just got very interested in her learning. I was young when she was born. I was 6, and from that moment on, I was just very interested in how she saw the world and her learning, and it just morphed from there.
And so you entered into that world.
Yeah, because she was part of the family, and we all worked really hard to uh, get her an education that would help her in her adult years, and she's still around and doing wonderful things.
Isn't that something? Isn't that something? And Jill, you're a parent as well. I think that's important for the audience to understand. You're a parent of a child who's neurodivergent.
I'm a parent of 2 children actually who are neurodivergent in different ways. My son, my older son, has an 2 spectrum diagnoses, one the ADHD spectrum, and he's actually finishing up an autism diagnosis as well as an adult. And
Okay.
my daughter has sensory uh, issues and mental health issues, so she is also neurodivergent.
Isn't that some? Okay, so you know it very, very closely, not only as a professional, but as a parent.
I do, and as a grandparent, my
Yeah.
son's 8-year-old daughter was diagnosed 3 years ago with autism and speech and language challenges.
Isn't that something? Jill, what's a common myth or a misunderstanding about comorbid diagnoses that you wish more people knew or understood?
That's a really good question. Comorbidity is defined scientifically defined as one person having 2 or more uh, conditions at the same time, diagnosed with 2 or more conditions. And so an example of that might be that a child's been diagnosed with autism and a secondary diagnosis of ADHD or speech and language delays, global delays, things like that. A myth is that these, children who have a comorbid diagnosis can't learn. That's probably one of the biggest myths, which is just so not true. And I have years and years of proof of that you just find the right fit for the child, not the child fitting into the right program or the right treatment.
Maybe say that again for our audience. I think that's important to hear. Can you just repeat that for our audience?
Sure. So generally, the outlook is the child gets referred to a program in a school setting or a private setting, and that child has to fit into the prescribed program. Whereas uh, they're so individualized. I mean, if you've met one child with autism or one child with ADHD, you've only met that one child because those are spectrum disorders, and the spectrum means there's a wide range of characteristics and uh, the ways that people profile or children profile with a diagnosis. And so we try to fit my philosophy is trying to fit the program or the treatment to the child. That works best. And that's what I advocated for my son when he was younger.
Okay. So the biggest myth I'm sure there's many, but one of the biggest myths is that children on the spectrum or children with a dual diagnoses or comorbid diagnoses can't learn, and you're saying that's a myth. They can learn, and then that myth is perpetuated because the way the system's set up, the child's supposed to fit into the prescribed way of teaching. You're saying that's
It doesn't work.
doesn't work.
It doesn't work, and I think that there are beliefs still to this day, and I mean, we're in 2025 here, and the understanding about autism and ADHD and other spectrum disorders is has gained substantially the knowledge around that, but it's still a very slow process for institutions to understand, like educational institutions, to understand that if you fit the program to the child has a better opportunity, greater opportunities to learn and to move forward with their lives and their functionality and so on and so on and so on. And a comorbid diagnosis doesn't diminish that in any way, shape, or form. You just treat each diagnosis or program for each diagnosis separately. And you
That's
find the
so
commonalities between those two
yeah,
diagnoses.
that's so encouraging. Jill, give it to us again, if you would please. Just whether it be a parent, a therapist, a teacher, an educational assistant. What How would you describe a comorbid diagnosis to a beginner? Again, to a parent who got this news about their child, again, maybe a teacher, a an educational assistant, etc. What sort of, in basic terms, is a comorbid diagnosis?
In basic terms, you have a child who goes through an assessment process at a young age, and the the assessing um, individual, doctor, psychologist, psychiatrist, says your child has come. The diagnosis is two different uh, things. One may be ADHD, and one may be autism. And so
Okay.
that child has two or more diagnosed conditions.
One of the questions, Jill, that I think a lot of people have is it curable?
Autism and ADHD are not curable.
Okay.
There's no cure for these things, but there is some pretty amazing programs out there to treat this. If we want to get medical, treat the symptoms of these diagnoses. We like to talk about um, it not so much as treatment, but as ways to help your child live their life to the fullest. It doesn't matter who they are, live their lives to the fullest because it is doable. It is achievable.
Can you share with the audience, Jill, a story or two of, again, because you've been in the field for 40 decades, of students that you've worked with that have in fact gone on to be contributing members of society, where there's lots of hope?
Well, I have personal stories. I have a
Yeah, sure.
I have a family member, a young man, who has an autism diagnosis. He's an autistic person. He's brilliant in gaming and designing games. And so he's gone on to go to university to be a game designer. And he's excited about it. But he went through the gamut of challenges as a young man, as a young child. And he's just, with encouragement from his parents and advocation and uh, getting through school despite having some really challenging health issues.
That's encouraging. That is inspiring.
It is, and
I'm
there's so many more of those stories too.
I was gonna
My
say,
own
I'm sure if
son,
I gave you time, yeah, if I gave you time, you could come up with
exactly.
stories. Jill, as a parent of a child who has a diagnosis with autism and they're requiring additional supports academically, socially, just generally in life, what do you wish as both a parent as well as a professional educator? What do you wish that I guess I'll lean on the parent side here.
Mhm.
Someone had asked you about your children and kind of what your children needed.
Who is my child? You are the expert of your child. What can you tell me your child needs? And how can I support your child within, say, the public school system? What's the best way to support your child? And we'll do our best to make that happen. That's what was missing. And the lack of understanding of, my child sees the world differently because he's a neurodivergent person. It doesn't mean he's a lesser person. It doesn't mean he can't learn. Uh, it just means he learns in a different way.
Again, lots of reasons to be optimistic and hopeful.
Absolutely.
Jill, in your 40 years of experience, what are some of the biggest challenges that you can speak to for parents who have a child with autism? And that's the first part of the question. Second part of the question is, what are some words of advice that you would give to them who are listeners? Because it's an incredibly stressful time. And I know as a therapist that it can impact the family unit. It can cause unique stresses
Right.
on the unit. It can cause confusion. There can be a lack of predictability. So, yeah, if you would speak to that question, I'd appreciate that.
I think one of the biggest challenges for me as a parent, and I have had challenges as an educator, um, was accessing services
Okay.
and keeping those services and trying to get people, professionals, community professionals, to understand that this just isn't a short-term thing. My child needs support uh, throughout his life or her life, and to have those resources available and ready for when the child ages out of childhood and becomes a young adult or in teenagehood, whenever, because the needs are different as the child ages, like anybody else, any other child. And I think the biggest piece of advice that I would give parents is to take care of yourself. Take care of yourself. Do the things you need to do to keep yourself going and refreshed and find the joy in your neurodivergent child because they are amazing people. Absolutely amazing people. And I've spent 40 years being taught by neurodivergent children. And that's been a very big gift that I've received from neurodivergent children, from my own children and from the children I've supported and taught over 40 years.
Isn't that something? Jill, can you speak to those who are listening who may be experiencing the stress that it places again sort of on the family unit? You've seen it from both worlds. You've seen it from the inside as a parent, but also as someone who has coached, mentored, educated the parents on this particular topic. What advice can you give to those who are listening who can relate to a lot of what you're saying, to relate to the diagnosis, but their question might be to you, but gosh, Jill, the tension or the stress, the strain that it's having on my marriage, on my family, or Jill, how it's impacting my other children who um don't have the diagnoses. It's a very real issue. And I think that it's front and center. Can you speak to that?
Well, I know for myself, it had strain on my marriage. Um, and I knew as having the experience of teaching children on the spectrum prior to having my own kids, um, the stress that other parents were going through. And then when I had my own children and they were diagnosed, I could understand that it is a different perspective and that I saw myself as an expert of my children, on my children. My husband didn't see it that way at the time because he didn't understand it. And so information gathering is really, really important, but it isn't the end piece because what's most important is us listening to our children. What do they need? What's going on for them? Being really, really observant of of our children, but also being very cognizant of how is it affecting our other children, spending
Yes.
time with our other children, making the time with them special. It's really hard not to make our other, the children responsible for that siblings um, behaviors and things like that. It's a big ask of our own other children to be the caretaker of our child who's neurodivergent. That's very, very demanding for another child. And then to educate, to both be educated, both partners in the relationship, to be well educated around, what are the resources available to me? How do I access funding? How do I access community therapists? I need somebody to tell me this. Where do I go? Who do I contact? How do I get the money for autism services or spectrum services? So on and so forth. And that was a real big challenge for me. And I was left, quite frankly, to do most of it myself. Um, and some days I wanted to give up and just say, to heck with it. I can't do this anymore. I'm exhausted. I'm not getting sleep because my child's not sleeping. I'm not eating because I'm too busy trying to find things for my child to eat that he will eat because he was such a picky eater. Same with my daughter. Um, I can't do this all by myself. And I would take a step back and just say, okay, these are children. These are my children, and I'm going to hang in there. And it's easier said than done. I did a lot of self talk. I did a lot of crying. I did a lot of screaming and yelling and out of frustration, but I hung in there. It does get better. I can say that. It gets easier because as your child learns, you learn to I don't know if I want to use the word cope, but you learn how to manage life. And through the eyes of a neurodivergent person, that's very different. Coping is very different.
One of the real painful aspects that I've seen with parents who have a child who have a diagnosis, is they somehow bring it back to themselves and think that it's their fault. And I'm curious in your years of experience, and of course as a parent, when we talk about the myth perspective or
Mhm.
myth that's perpetuated, I've seen that, Jill. I'm not kidding when I say to you dozens and dozens of
Mhm.
times. And it's self-deprecating, and then they start beating themselves up and blaming themselves for their child's, you know, challenges that they face. Can you kind of unpack that for us in that, if you don't mind?
Not at all. I experienced that myself. And there's still, my son is 40 and they're 40 years later, 39 years later, it still hits me. Oh my gosh. Maybe it was when I did this, or maybe it was when I went out and had a cocktail and didn't know I was pregnant. Maybe it was my bad parenting. I still do that. And then I tell myself, no, autism is not because of bad parenting. Autism has so many theoretical um, implications of what causes autism. There is 100 out there, and there are some that have been narrowed down, but it is not because of bad parenting. I can't emphasize that enough. Yes, we make mistakes as parents, and yes, there is some silly parenting out there. Um, you know, I think the biggest thing is to keep an open mind and learn, like as I said previously, learn about the 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 condition that your child's been diagnosed with and go from
But
there.
yeah, and I think, Jill, it's important to ascertain, and again, you're the expert and you're affirming this. It's not a parent's fault.
It's not.
They didn't cause this. They didn't create this. So the first thing they have to do is to release themselves from the responsibility of this.
Exactly. And as I said, it's a life it's almost a lifelong process. I mean, here I am, and my child's 40 years old, and I'm still trying to let go of that because as parents, one of our jobs is to feel guilty. Really? Uh, Somebody who told me that a long, long time ago, as a parent, it's our job to feel guilty. And we feel guilty about everything. Oh, I shouldn't have said that, or I shouldn't have fed him that, or she shouldn't have wore that to school, or I shouldn't have talked to the teacher about this. It just goes on and on and on. And we can be guilty our whole lives. It's okay to feel um in a way it's okay. It's natural to think, oh gosh, what have I done? And it's taking a step back though and saying, you know what? I did nothing wrong. I didn't consciously do this or this.
Why, in your opinion, why is there such an increase in the diagnoses then of autism or comorbid diagnoses? I
Well,
get
there's
that.
yeah, there's a number of reasons. There's a number of theories around those reasons. We have everything from the diametric brain theory, uh, dendritic connections and neuron building, and we have the synapses thing, and that's all the science of it. And uh, you know, children on the spectrum are not producing enough neuronic connections, and so on and so forth. We have the extreme male theory around, because we do know that there are more males born, people who are born male with um, a spectrum disorder like autism and ADHD. Is it about the male, something about the male brain that systemizes everything? And the female person who's born female, their brain is more of an empathic brain. There's those theories. It is, um, it's crazy. We could go on and on, but we do know that there is a genetic component because it will run in families. It runs in mine, and uh, it may have an environmental component as well, in that there could be environmental pollutants and so on and so forth that are part of that uh, cause causational uh, brief on one of the spectrum disorders. So
So there isn't one single cause of it.
nope,
Yeah.
and it's unpredictable. You cannot predict it.
I think that's important to understand, the predictability piece.
Yeah, and it doesn't mean that subsequent uh, pregnancies are going to end. Birth. You're not going to birth uh, seven more children and all who have autism, although it's happened. I mean, I worked with a family who had seven children with autism, and they were a very, very, very happy family, a very functional family. Um, They're all neurodivergent people.
Jill, with such a it's an intense field that you work in. It's intense.
It is.
What keeps you going? What inspires you to not only keep going, but just to you have such a passion. You and I talked earlier before this interview, and I could feel your passion. You had such a deep conviction
Thank you.
for this work that you're in. And yeah, it was really impressive, and of course, it led to today's interview. And so, what inspires you to keep going? Where does this conviction come from that you have?
My own children and how I want them to be looked at and treated and given the opportunities in life that everybody else has, non neurodivergent people have. But I have a little story that might speak to that. I had a young boy who I spent 7 years teaching in the same classroom. He came back to me across his elementary schooling, and he wasn't very affectionate. At least he didn't demonstrate it. He may have had those affectionate thoughts in his head, but he didn't know how to express it. And I had to take a leave because my husband got very sick, and I was gone for 3.5 months. And when I came back, he walked right up to me and very close to my face, and he said to me, "Oh, there you are. I love you and I miss you." And that's what keeps me going, is those really awesome moments that only children can give you, you know?
Sounds rewarding. Sounds very rewarding.
Very, very much so.
Very pure, very authentic. It's very heartwarming, isn't it? It's
It is.
special.
It is.
It's
It
just
really is.
yeah, and it goes back to just the words that you and I discussed again prior to this interview. Was just there's something that's very innocent and pure about children who and even adults really who have the diagnosis. It's refreshing in many respects.
It is, and it provides a different perspective for the people around them. It's just if you sit and you take the time to observe a neurodivergent person, it's fascinating. It's amazing. It's There's nothing like it. They just open up the world for you.
Yeah, and as you mentioned earlier, you've learned as much from them as they've learned from you.
Exactly. And I'm still learning. After 40 years in the game, I'm still learning.
Isn't that something? Wow. You didn't like it when you and I had this pre-interview conversation. I said, Jill, you're a heavyweight in the field and you're
No.
quick to dismiss that. But 4 decades and all your experience and all your stories is pretty impressive. Jill, if people want to learn more about this, where should they start?
I think well, to start with, be cautious where you're getting your information from. Do
Okay.
not go to Google University. Go to some of the more established medical sites. Go and look at the research, peer reviewed research, Psychology Today, those kinds of articles. You can read more and take everything with a grain of salt and look at it and how that fits with your own child and your own life, and take bits and pieces. Be really eclectic around your approach to information. What fits, what doesn't fit. Don't let an article tell you that you've got to be this way or you've got to do this. It's got to fit with your family, especially for your child.
I think that's just so important. I just don't think we can emphasize that strong enough, Jill.
I don't think so either. It's just we find out and we find our paths, and we go on this remarkable journey with our children, neurodivergent children. But there's snakes in the grass along the way, and we have to be really, really open minded and careful.
What's next for Jill?
Well, I'm still teaching. Um, I'm not sure. I just enjoy teaching. I love it, and I've who knows? I'm open,
Isn't
very
that
open.
fantastic? It's so good to hear. Jill, I thank you so much for your time. I sincerely hope that some of our viewers are inspired, that they feel empowered, that they feel a sense of relief after listening to you.
I hope so.
And if they want to get in touch with you, they can certainly contact us here at Inspired Onwards, and we can,
Sure.
um, help them. And I think, Jill, with just all the feedback we've gotten prior to this interview, we'd like to have you back for part two.
Oh, well, very, very kind of you to invite me back. I hope
So
I've given a little bit of encouragement to some of the parents out there. Um, and it's been an absolute pleasure to talk about something I'm really passionate about.
thank you so much, Jill. Thank you for your time. And to the viewers who are watching this, we hope that you've been inspired today.